Public health units, like the Haliburton-Kawartha Pine Ridge District Health Unit, serve as local leads in distributing naloxone to community partners through the Ontario Naloxone Program. The Ministry of Health defines the types of organizations that are eligible to participate: community health centers, AIDS service organizations, shelters, outreach programs, withdrawal management programs, hospitals with an emergency department or urgent care center, consumption and treatment services and supervised consumption services. Police and fire services and St. John ambulance branches are also eligible to access naloxone through the Ontario Naloxone Program for use in responding to opioid overdoses. To help fill identified gaps in access to naloxone, an expanded access component was added to the program, and hospital inpatient units and local emergency management services are now eligible to access the Ontario Naloxone Program as well. The Ministry considers the eligibility of organizations and notifies the health unit whether applicants are approved to participate or not. Individuals eligible to access naloxone through the Ontario Naloxone Program include people at risk of opioid overdose, family and friends of people who are at risk of opioid overdose. The Ontario Naloxone Program does not provide naloxone to schools, colleges, universities, private businesses, municipalities, or any other type of organization that is not identified by the Ministry or the general public. Pharmacies that choose to participate in the Ontario Naloxone Pharmacy Program can distribute free naloxone to eligible individuals and can request to be added to the locator map so people know they can get naloxone from their location. A health card is not required to receive a free naloxone kit. Participation in the Ontario Naloxone Pharmacy Program is voluntary, and although many participate, we suggest calling ahead or searching online to see what locations carry naloxone kits. Individuals eligible through the Ontario Naloxone Pharmacy Program include current and past opioid users at risk of returning to opioid use, friends and family of people who use substances, other individuals in a position to assist a person experiencing an opioid overdose. Naloxone access points through both the Ontario Naloxone Program and Ontario Naloxone Pharmacy Program can be found here. Ontario's Workplace Naloxone Program is providing support to employers who are required to comply with the naloxone requirements under the Occupational Health and Safety Act by providing free naloxone training for up to 2 workers per workplace and/or 1 free nasal spray naloxone kit per workplace. Employers must provide a naloxone kit when they become aware or ought to reasonably be aware of the following scenarios. There's a risk of a worker opioid overdose. There's a risk that a worker could overdose while in a workplace where they perform work for the employer. The risk is posed by a worker who performs work for the employer. If all of these scenarios are present, the employer must comply with the Occupational Health and Safety Act requirements to provide naloxone in the workplace. The requirements do not apply to workplaces where the risk of an opioid overdose is created by a non-worker, such as a customer, a client, a patient, or other member of the public who may be present in or near the workplace. Visit the Government of Ontario website for more information on the Workplace Naloxone Program. If you are not required to have a naloxone kit in your workplace, but you would like to have it, you may want to create your own policies and procedures and review through your legal representation. If you're not eligible for naloxone through one of these programs, you can purchase it by calling a pharmacy and request to purchase a naloxone kit.